I have a rather unique skill in curing facial cancers. I'm able to use a FDA-approved anti-cancer drug, and I can take that and do pretty amazing things and remove large tumors from persons' faces and barely leave a scar at all. I think the best way of showing what I can do is to produce some imagery and let you see the before and after of what I can do taking cancers off of people's faces. This image is an excellent opportunity to see where a cancer that was comprised of two cancers, actually, the biopsy showed an invasive squamous and a basal cell carcinoma on a forehead of maybe 38-year-old woman. What I carefully did is I pieced out the actual tumor after I had used the cancer drug, the topical cancer drug that got the immune system to attack it and cause it to be segregated from the precancer tissue that surrounded it. So the large area of redness that comprises most of her left forehead is precancer, and in the center you see the actual squamous and basal cell cancer, which with careful dissection I'm able to separate that cancer from the normal tissue that hasn't yet turned to cancer. It's not normal tissue, it's precancer tissue, but it hasn't converted to actual cancer. And so by very careful dissection, I don't damage any of the surrounding tissue. And what a cancer does is push, as it grows, the good tissue out of the way. And if you can get the just cancer tissue separated, the normal tissue will retract and recoil back in and fill that space without leaving a recognizable scar, which you can see on the right-hand photo that you can barely tell where that actual cancer was originally. In this second image, we have a 80-some-year-old veteran who had multiple precancers on his face, as you see as rough spots and scabby looking things. And then there are two red spots. The top one is a squamous cell cancer that has been partially shaved off, and the other one is untouched squamous cell cancer growing on his forehead. Now, with proper treatment, with careful dissection and use of the anti-cancer drug, I can completely clear him of all the precancers, as you see in the second picture. This is not completely healed, but it's almost completely healed. And you can see where the other cancers were, but they're just barely red spots. There's not big scars. There was no disfiguring and no massive loss of tissue that needed to be skin grafted. And it took maybe about 2 months or so of treatment, but in the end, he was not disfigured. He did not have to undergo radiation or chemotherapy, and his immune system was able to destroy all the precancers so that these cancers that he was beginning to get on his head no longer are an issue. He is basically free of all those precancers, as well as the two cancers that you can see. My technique is not only very successful for facial cancers, but extensive skin cancers on other areas of the body are equally as easily treated. This next image is of a person who was exposed to Agent Orange in Vietnam and covered his face with his hands, and the Agent Orange got on his exposed arms. In this patient, you'll see numerous white growth-like spots that constitute the actual cancers being surrounded by reactive tissue that is rejecting the cancer. And in the middle of the picture, I have a curette that has lifted that cancer off of the skin without damaging the matrix of the skin, so that there isn't actually scarring resulting, but just some hypopigmentation. The skin is still viable and doesn't require a skin graft and did not actually scar. Those white areas are just the loss of pigment, because this attack by the immune system will kill any cell that has cancer potential, and it killed the cells that have pigment in them as well. And if it didn't kill those pigment cells, the cells that were precancerous could go on to melanomas. So even though you have a loss of pigmentation without really scarring, the outcome is extremely preferable to having this entire section of his forearm excised surgically and then skin grafted later. I think this is a much better way of treating multiple skin cancers on other areas of the body. What I've shown in this video is that with the proper technique, a combination of an FDA-approved cancer drug, a topical cancer drug, combined with surgery, very carefully done, and dissecting off just the cancers, can get a very good cosmetic and long-lasting cure for basal cell cancers, squamous cell cancers, and precancers of the skin and even the face. And I think this constitutes a very reasonable approach to these tumors, and I'm happy to discuss this further. My contact information is available at the end of the video. Thank you very much.